Lung cancer treatment is undergoing a quiet but meaningful shift, and for some patients, it's a turning a long, exhausting treatment into something far more manageable. Joining me now here via Zoom is Dr. Coral Olendzowski, the medical oncologist at University of Miami. Thank you so much, Doctor, for being with us. Let's start with what is sub-Q and how is it going to be meaningful for patients?
Yes, so thank you for having me. So sub-Q stands for subcutaneous administration. And so we are basically bypassing the need for the patients to get the traditional IV medications where the patients need to get hooked up to IV catheter where they have to find their blood and inject a catheter, and so they can have the medication slowly dripping into their veins over hours, whereas subcutaneous is just basically like a very small needle, way smaller than even the flu shot or any intramuscular administration. Goes straight under your skin, anywhere where you have kind of like fatty skin, whether that's your arms or your abdomen or even your thighs, and just gives the administration in over 3 minutes compared to hours, just really giving the patients time back.
And so as far as when the medication enters into your body, how does it work? Is it the same as the traditional medicine that we've been seeing, or is it a bit more targeted?
So it's just the same exact medication, it's just the mode of administration is a little bit less. So instead of going straight in through the veins where it has to take hours, right? Because we have to dilute it in different IV fluids, because this goes straight, only the chemo, no IV fluids, straight into your skin. It slowly gets diffused in through other fatty cells in the body, and then ultimately is absorbed into the bloodstream.
To ask you that at this point they just want to get better. So if they were to ask you which treatment is better, what do you tell them?
I tell them it's the same. We're not really compromising on effectiveness of the treatment. These treatments are studied for many, many years. They're compared head to head with the IV version, and they're shown to really be equivalent. So it's not only that we're giving the patient really the time back, quality of life, we're decreasing chair time, we're just giving them the exact same effectiveness and efficacy treatment. It's just in a way more convenient option.
And so where is this available?
This is really available in any chemo center. So I encourage patients to really, if you have lung cancer or any type of cancer, ask your doctor, am I a candidate for a subcutaneous injection? Does this chemo come in the subcutaneous version? Because I've heard about it. And so just ask the doctor that question, and you might be a candidate for this. We still don't have all the drugs available in this form, only some of them, but it's always important to really advocate for yourself and just ask. And if the patients really need more information, whether that's about sub-Q medications or lung cancer in general, I encourage them to visit the lcfamerica.org.
Yeah, we put a link to that site on our website. Thank you so much. We know attitude is everything when you're fighting any kind of illness, especially cancer. So getting time back, feeling as normal as possible has to be very, very key in fighting the illness. Thank you so much, Doctor. Appreciate your information and how we as patients can really advocate for ourselves, ask those questions. So thank you so much. As I mentioned, you can go to our website, WPBF.com. You can download the free app for more information.